Okay, good afternoon, everyone. My name is Shannon Kupka with Comagine Health. I'd like to welcome you to our Hot Topics series. These webinars are designed to support your efforts and provide you great ideas on caring for your residents in a brief time frame to accommodate your busy schedules, and brought to you by the Comagine teams from Idaho, Nevada, New Mexico, Oregon, Utah, and Washington. We appreciate you joining us today for this special 1-hour session, and we will be recording and posting this session for later viewing. A few housekeeping details before we start. Please let us know who's on the webinar today by entering your name and facility in chat, as well as the names of any folks joining you so we have an accurate head count of participants. And please make sure that when you chat, you do so to all panelists and attendees so we can see your great comments and questions. Your cameras and microphones are muted. If you'd like to ask a question, please enter it in chat and we will facilitate a question and answer session at the end of the presentation. We are delighted to have our two presenters with us today to talk to us about keys to flu vaccine promotion, resources for communicating the importance of the flu vaccine to patients, clients, and employees. Renee Brocker has been working as the Centers for Disease Control and Prevention Public Health Advisor with the Nevada State Immunization Program since 2019. She coordinates efforts to increase flu vaccination coverage across the state. Ms. Brocker graduated from the University of Dayton with a bachelor's degree in international studies. After graduating, she joined the CDC Public Health Associate Program stationed at the Ho-Chunk Nation Health Department in Wisconsin for 2 years, where she assisted with public health accreditation efforts and community health assessment and improvement planning. Brianne Van Dyne currently serves as the Education Manager for Immunize Nevada, Nevada's only statewide immunization coalition. In her role, she manages the organization's immunization training programs and identifies opportunities for collaboration with local and national partners for in-person and virtual education activities for healthcare personnel, pharmacists, and public health professionals. Ms. Van Dyne earned her bachelor's degree in public administration with a specialty in healthcare management from Colorado State University. In her previous role, she served as the adolescent immunization coordinator for the Nevada State Immunization Program. And I will now turn things over to Brianne and Renee, and let's do a quick test audio with the group. Renee, could you, since you're starting us off, could you say hello?
Sure, yeah, can you hear me?
Can folks just go ahead and chat in if you can hear? Okay, we have a yes. So Renee, you may get started.
Awesome. If you could go to the next slide, please. So hi everyone, yeah, my name is Renee. I'm with the Nevada State Immunization Program, and we're really happy, Brianne and I are really happy to be here today. As Shannon said, we'll be talking about flu vaccine promotion and resources for communicating the importance of flu vaccine to patients, clients, and employees. Can we go to the next slide, please? So I just wanted to give a quick overview of what we will be covering today. So first and foremost, why flu vaccination is so important this season during the COVID-19 pandemic. And then I will cover just briefly the immunization coverage rates in the 6 states that Comagine Health works in. Then I will go over flu vaccine communication methods to communicate with patients, and CDC's SHARE method to make a strong recommendation and dispel flu vaccine myths. And then I'll kick it over to Brianne, who will go over encouraging flu vaccination among clinical and non-clinical healthcare professionals and overcoming barriers to flu vaccination among healthcare personnel. And then creating a culture of prevention in your workplace, facility, or clinic, and making it easy for staff and patients to get their flu shot. And then lastly, we'll leave you with some resources that can kind of help you moving forward. So next slide, please. So first, I'll go over flu vaccination in the context of COVID-19. As many of you are probably already aware, this is a critical part of the COVID-19 response. In a normal year, flu causes millions of illnesses, hundreds of thousands of hospitalizations, and tens of thousands of deaths in the United States. And concurrent circulation of SARS-CoV-2 and flu viruses and the resulting illness could place a tremendous burden on the healthcare system. So flu vaccination will be more important than ever to decrease the burden of respiratory illness on the public and the healthcare system. And it will help decrease doctor visits and hospitalizations for flu. It will decrease the risk of co-infection with COVID-19 and ensure adequate resources to manage COVID-19 cases. And especially for people at high risk, vaccination is important to decrease their risk of severe flu illness. And many of these people at higher risk from flu also seem to be at higher risk from COVID-19. So it's just an extra layer of protection, especially to decrease that risk of co-infection for them. Next slide, please. So continuing on that vein, ongoing COVID-19 activity will affect when, where, and how flu vaccines are given. And I'm sure a lot of you have already been seeing this. Providers will need to vaccinate people safely and efficiently using infection prevention measures like physical distancing and masks, and ensure that patients feel safe seeking out vaccination services when they're being told, to social distance and stay home, that this is a essential service and something that you should be leaving your home to do. And also, we're kind of framing it as using flu as preparation for COVID-19 vaccine because we're trying to vaccinate as many people as possible, more people than ever, really, and using the different infection prevention measures that haven't had to be used before in mass vaccination efforts. And so this is kind of a way to prepare for what's to come when COVID-19 vaccine becomes available. We also see a need to extend the flu vaccination season. So we say this every year. Typically, flu vaccination tends to kind of peter off at the end of November, but with the importance of it this year, it really should extend into 2021. And it's better that someone gets vaccinated in February or March than not getting a vaccine at all. And lastly, vaccination plans will need to integrate CDC, state and local COVID-19 guidance and messaging, and include awareness of local COVID-19 and flu transmission trends and their impact on providers. And many of you may have already seen this, but the CDC vaccination guidance during a pandemic is a good resource to reference for this. Next slide, please. So I just put the different flu immunization coverage rates among the 6 states on this slide. And as you can see, we know in Nevada, we have the lowest rate in the country. Idaho is not much higher. And then Oregon, Utah, New Mexico, and Washington are all above 50%, with Washington closer to 60%. The goal typically is 70%, so we all still have work to do, and the efforts this season will be really important. So next slide, please. So going into communicating with patients, healthcare providers play a really significant role in helping protect patients and their communities against flu. And a strong flu vaccine recommendation coming from a trusted healthcare professional is one of the most important factors in patients accepting the vaccine. Healthcare providers really should use every opportunity and patient encounter, whether it's a sick visit or a checkup, during flu season to assess vaccination status and administer the vaccine to all eligible patients. You can use text message, email, or phone reminders to encourage your patients to come in to get vaccinated. And if they refuse the vaccine initially, continue to follow up and continue the conversation. It's really about having empathy and meeting the people where they are, and just having a conversation with another human and trying to understand where their concerns are coming from. Another kind of thing to do is to use a presumptive approach. So say today we're going to give you your annual flu vaccination. It's more likely that people will accept it that way as opposed to asking them if they want it. But if they still do have questions about it or concerns, you can use CDC's share method to make a strong recommendation and provide important information to address flu vaccine myths and help patients make informed decisions about vaccinations. Next slide, please. So this is just an outline of the share method. We have the link at the bottom of the slide for you to reference later, but I just wanted to go over the different aspects of it. So first, you share the reasons why the flu vaccine is right for the patient, and you can base this on different variables like their age, health status, lifestyle, occupation, or other risk factors. You can highlight positive experiences with flu vaccine, so personal or in your practice, and reinforce the benefits and strengthen confidence in flu vaccination. You should be able to address patient questions and any concerns about the flu vaccine. Typically those deal with side effects, safety, and effectiveness of the vaccine, and be able to use plain and understandable language so that the patient understands what you're saying. Remind patients that flu can be dangerous and unpredictable, and flu vaccines protect them and their loved ones from serious flu illness and flu-related complications. So it's not just the high-risk groups. Anyone can get sick or be hospitalized with flu, and so it's important to remind people of that. And lastly, explain the potential costs of getting flu. So these, not only the financial costs, but also serious health effects and time lost, such as missing work or family obligations. Next slide, please. So just wanted to kind of go over some common flu myths that you can use or you can address using the SHARE method. So there are a lot of safety concerns with flu vaccine, and flu vaccines are safe, and millions of flu vaccines have been safely given for more than 50 years. Many people have concerns about side effects or getting the flu from the vaccine, and the body's natural response to vaccination may result in common things like a little redness at the injection site or a slight fever, but those are usually mild and pass quickly, and flu vaccine cannot cause flu illness. In the context of COVID-19, flu vaccine doesn't protect against it, and it doesn't increase your risk of getting it. A lot of people say they don't want to get the vaccine because of the effectiveness of it. And yes, you can still get flu if you're vaccinated, but you are still less likely to get sick, suffer from severe illness, and end up in the hospital. And lastly, like I was saying, flu can be serious and even deadly for anyone, regardless of their age or health status. And that's why getting a flu vaccine every year is so important. And it's not just about protecting yourself, it's about protecting the people around you, your coworkers, your family, your friends, anyone. And so that's a big part of it as well. So next slide, please. And I will kick it over to Brianne now.
Hi everyone, I wanted to turn my video on real fast so that you know that it was a real person behind this black screen. I'm just referencing notes to make sure that I get you all of this information dense presentation info, so I'll be turning it off, but just wanted to preface it with that. So to start, Renee discussed some techniques for communicating the importance of getting an annual flu vaccine from the perspective of a provider and patient recommendation, but I wanted to provide some insight as to ways clinical and administrative leaders and even colleagues can promote getting vaccinated against the flu in your respective offices and facilities. And I want to note for the duration of today's presentation, we use the term healthcare personnel to describe the broad array of professionals that work in healthcare settings. And just so you know, this includes everyone from clinical to non-clinical staff, to be clear. And so to start, why is it so important for healthcare personnel to get vaccinated against flu? Many of these reasons likely seem pretty obvious, but it's important to review so that we're clear on the role that you all play in promoting health and preventing disease in work settings. So the first reason would be, as Renee discussed, flu can be serious and it can lead to hospitalizations and even death. And anyone can get sick from flu, including people who are otherwise healthy. So there's a little bit of a misnomer in that the flu vaccine is primarily for the young and the old. That is for good reason. Young children, especially ages 5 and under, are especially susceptible to flu illness and hospitalization from flu, as of course are our older populations, just due to weakened immune systems that occur with age. But anyone who is otherwise healthy can be impacted by the flu. And you're interacting with people across the lifespan every day. So it's just important to do your part to keep everyone healthy around us by getting vaccinated. Again, that's not a perfect tool, but it is the best tool that we have at our disposal, and so why not make use of it? The second reason is you can get flu from patients and coworkers who are sick with flu. So you getting vaccinated, again, just provides that extra layer of protection from coworkers and the folks that you work with in healthcare settings who are coming in and infected with influenza. A third reason why it's so important for you all to get vaccinated with the flu vaccine is if you become sick with flu, you can spread it to others even if you don't feel sick. So we've all become very well acquainted with the term asymptomatic carriers due to COVID, and those are carriers of a virus, of a coronavirus with relation to COVID, that have the virus but aren't exhibiting any symptoms. And the same is true for influenza viruses as well. So you can be infected and still pass that along to others who are more susceptible to hospitalization, even again, if you're a healthy individual. And then lastly, by getting vaccinated, you help protect yourself, your family, and your patients. It's really that community immunity, herd immunity model that protects those who legitimately cannot get vaccinated, like the immunocompromised and those under 6 months of age. So we all want to do our part. Next slide. For the last several years, CDC has conducted an opt-in internet panel survey of U.S. Healthcare personnel to estimate influenza vaccination coverage. So the survey size for the survey that we're referencing today is for the 2019-20 influenza season, was a little over 2,400 respondents nationwide. And of those respondents, you can see how many reported here that they had received their flu vaccine. Overall, 80.6% of healthcare personnel reported receiving influenza vaccination during the 2019-20 season, and this is similar to reported coverage in the previous season. So that's a decent amount of coverage, but you can see that there are some significant gaps. This graph depicts vaccination coverage by profession type, which is helpful in that it demonstrates that those professions that seem to have gotten the clear message that flu vaccination is important, so physicians, nurses, pharmacists, and other clinical personnel. And those professions where the message doesn't seem to be getting across. So assistants and aides, and then those non-clinical personnel who work in healthcare settings. Next slide. This chart breaks down the flu vaccination coverage rates by work setting, which further identifies where there's significant ground to be covered. Again, hospitals and other clinical settings are leading the charge here, whereas long-term care facilities, ambulatory care locations, and physicians' offices were tied for the lowest rates of coverage. So referencing this chart, or the chart in the last slide, we saw that it highlighted the low flu vaccination coverage rates among non-clinical staff, and then those assistants and aides, which are represented more in the long-term care settings and the like that we see demonstrated on this chart. And that likely explains why such facilities and practices are under immunized, just based on the composition of the staff who works there. Next slide. So surveys are only as useful as the guidance and information that they provide for the reasons behind what's being assessed. So aside from demonstrating the professions and work settings for healthcare personnel that demonstrate the highest and unfortunately lowest immunization rates for flu, what else did that survey tell us? First, coverage was 25% higher overall in settings where flu vaccination was required by the employer. That's really important to note. We see that in the childhood immunization space as well. When we put vaccination requirements in place for school settings, we're of course naturally going to see an uptick in those immunization coverage levels overall. And this is due to a number of reasons, but the most of which is that we all usually, because we don't see vaccine preventable diseases on a large scale, kind of need that extra prompt and those safeguards in place that encourage us to make the right choice. So that's one of the big highlights of this survey here, is that that was a significant factor. And then to further break it down, flu vaccination coverage was 48.4% higher in ambulatory settings and nearly 46% higher in hospital settings where the vaccine was offered, promoted, as opposed to those ambulatory facilities and hospitals where those practices were not in place. So this is a factor that we're going to be discussing at length a little later. Just making as easy as possible for patients and personnel alike in your settings to get vaccinated against the flu. And then again, this is all to say that the low immunization coverage rates in long-term care facilities for the last season outlines the significant gap we have to cover for the 2021 season this year. Next slide. In addition to the CDC's annual healthcare personnel flu vaccination survey that we just reviewed, Linda from the Comagine team asked that we highlight a new weekly reporting feature that the National Healthcare Safety Network is offering this season. This tool, while optional, allows facilities to monitor site-specific flu vaccine coverage of healthcare personnel, which is really helpful for sites who are looking to assess where they stand in real time. This could be either to celebrate your successes or to identify work that needs to be done around flu vaccine promotion in your respective workplaces. The NHSN has also indicated that reporting and training materials will be online at the link we've posted here. As Shannon mentioned, we'll be posting this entire slide set for your reference, so you don't have to take screenshots or write really quickly to get this information down. But also Comagine will be in contact with everyone as we learn more about those reporting tools and training materials related to this site-specific immunization coverage assessment. Next slide. So we've provided an overview of what immunization, flu vaccination coverage among healthcare professionals looked like last season. So now we want to discuss some of the barriers that contribute to low flu vaccine uptake. And because we don't want to bemoan the problems that exist, we're also going to provide some of the strategies that facilities and practices can use to address these barriers. We've highlighted 5 of the most commonly cited issues, so bear with me as there's a good amount of information that we have to share today. So the first barrier we have is a lack of access to influenza vaccine. The strategy that we can use, or strategies to overcome this particular barrier, is to provide first and foremost free vaccine at the workplace. As cited in the survey, this is a major contributing factor. Again, convenience is key. So the more we can meet people where they are with relation to offering flu vaccine, the better off our immunization coverage levels are going to be. The second strategy to overcome this barrier of lack of access is to offer the vaccine at multiple times and locations convenient to all workers on all shifts during the flu season. This one's a little more challenging, especially if you don't store a vaccine on site, but it is possible to get a vaccinator on site, including your hospital partners or pharmacies in your area, likely if done at the beginning or end of those evening shifts and those off hours. So again, it's a little more difficult, but it can be done. And the third strategy is to use a mobile vaccination cart to take influenza vaccinations to staff. Again, convenience is key. So if we have the vaccine available right there, and we're letting folks know that we're coming around with it, we're again just meeting them literally in this case where they are to administer that vaccine. The next strategy is to provide staff with a voucher for vaccination at a drugstore or clinic. So I just wanted to say that flu vaccine is covered by most major insurances. It's also covered for those who are uninsured at various health clinics and community health nurse locations. And then many retail chains offer flu immunization vouchers. And if they don't, even if you created a simple flyer with pharmacies and clinics near your facility or practice, that's better than nothing. You know, that's just providing that needed information to help get those employees vaccinated. Next is to partner with a large healthcare organization like a hospital to provide vaccinations. We talked about that. We also talked about working with pharmacies to offer influenza vaccines for facility staff. Pharmacists will come out on site and immunize at various clinics. I will give the caveat that pharmacists are really taxed right now so far as their workload. So doing this in as far as advanced as you can is going to be helpful. Also, you want to make sure that we're making it worth their while, that a lot of people have indicated that they're going to get the flu vaccine that day. They like to feel that their time off site for them and away from the pharmacy is worth the next is to work with visiting nurses associations or community immunizers to provide vaccination on site. Later in the presentation, we'll be providing Immunization Coalition and State Immunization Program information, who may also be able to connect you with community vaccinators as well. And then lastly, offer influenza vaccine at mandatory trainings, departmental conferences, and other meetings. So this is all about maximizing your time as a leader and an administrator, if that's your role in your respective organization. We know that many of you are overwrought and that organizing a flu clinic on site just seems like one more thing to do. So let's go ahead and maximize what's already built into your schedules, and that includes those on-site staff trainings that you're already having. Next slide. The second barrier is beliefs. So belief that influenza vaccine or influenza is not a serious illness or not a risk for healthy people, that the vaccine is not effective, that it causes illness and side effects, or just a fear of needles. So the first strategy for overcoming the belief barrier is to provide a strong educational program for staff. Here in Nevada, Immunize Nevada has many existing webinars that can be utilized if it's something that you want to highlight in a staff meeting. Again, we provided last month a week's worth of flu-focused immunization webinars that were geared towards healthcare personnel. So you're free to go to immunizenevada.org/webinars and view and display any of the webinars that we have that are already tailored to healthcare professionals. And then another incentive is to perhaps offer continuing education credit for those respective professions that are recommended or represented at your workplaces. Anytime that can be offered, we see, at least as a coalition, that we see a large uptick in the utilization of those educational opportunities. The next strategy is to focus on the worker and their family, as well as the residents and the educational materials. And we'll be providing some resources in this vein towards the end of today's presentation as well. You don't need to reinvent the wheel here. Next is to share CDC's influenza vaccine information statements. Those BISs are the statements regarding the vaccine and its potential side effects, and just has additional information about the flu vaccine that's offered by law to anyone who receives an immunization, but it's also just a good reference tool for people as well. There's also an influenza vaccine myths and reality fact sheet that the Joint Commission has put out. We'll be sure to send that as well as a resource. And then using a declination form to learn why staff are declining vaccination to focus on your own messages. This is, of course, not the ideal strategy, but I think it'll really help you guys to hone down on, maybe persisting myths that occur in your respective workplaces, and just kind of identifying where you need to bolster those efforts. If it's an area of convenience, cost, all of those things can be identified through that declination sheet. And then lastly, asking vaccinated healthcare personnel to encourage their coworkers to get vaccinated. So this sounds corny, but Admin and leaders and colleagues setting a good example can be powerful. Don't underestimate the influence that you have. As all good leaders do, they lead by example, and this is just another highlight of that. Next slide. Okay, so the third barrier is high staff turnover. So some strategies for overcoming this is to offer flu vaccination education at multiple times during flu season. You don't want to invest necessarily in an employee that you know is going to leave in a couple of months, but it's important that everyone's getting that consistent information, no matter when they're starting that onboarding process at your facility or clinic or wherever it is that you may be operating. The second strategy is to offer opportunities to be vaccinated at multiple times, and then locations that are convenient to all workers on all shifts during flu season. Again, if this isn't possible, just providing that flu location sheet that's close to your respective facility where folks can get vaccinated is going to be a helpful tool here. Next is to educate and vaccinate staff as part of new employee orientations. You're just being consistent with your message here again, and just building it into those onboarding activities is going to ensure that everyone's getting that influenza vaccination is an expectation of working at your facility. Next is to establish a process for determining if flu vaccination has taken place. So this is can be in the way of accessing their immunization record through your state's immunization information system. In Nevada, this is Nevada WebIZ. We have a public access portal in which individuals can provide proof of vaccination. Also, they can get proof from a local pharmacy. And then obviously, if you're holding those immunization opportunities on site, you'll be able to assess who's been vaccinated. The next is to establish a written influenza vaccination policy for employees, and then again to work with pharmacy consultants to offer that vaccine on site, and just make that a standard practice of every flu season, that's something that gets organized. Next slide. So this barrier is healthcare professionals represent diverse cultures. So there's various cultural and ethnic and linguistic and education levels that are represented in your workforces. So we need to make sure that we're providing information that's catered to everyone, not just the homogenous group. So this includes accessing guidance from the HHS National Standards for Culturally and Linguistically Appropriate Services in Health and Healthcare, providing educational materials in multiple languages, including those vaccine information statements or VISs that we discussed earlier. And then lastly, Medline Plus provides health topics that may be good for some of those lower literacy groups. So that's a great resource to access as well. They have training videos on a variety of health topics, flu vaccination included, so that we're helping to meet people where they are. Next slide. This barrier is lack of enthusiasm about influenza vaccination. So strategies to overcome this particular barrier is in general in using a lot of those tools we've already discussed, just to establish a culture of prevention in your organization. So we'll be identifying some additional ideas in addition to the ones we already discussed in a couple of slides. Next slide. Thank you. So this again may seem just like one more thing you have to tackle, and we recognize that resources are scarce and that some of these strategies are going to require some extra work on your behalf. All that aside, there are some practical benefits for employers, and as a bonus, benefits for employees for fostering an environment where flu vaccination is the norm. So benefits of workplace vaccination for employers includes reducing costs by decreasing time missed from work to get vaccinated. So again, that's related to those on-site immunization opportunities. It reduces costs by reducing absences due to illness, resulting in improved productivity. So that helps your bottom line. Vaccination often already is covered by employee health plans, as we discussed too. So, you know, we have that added benefit. So why not encourage employees to use it? Benefits for workplace vaccination from an employee perspective would be along the same lines, reducing absences due to illness and doctor's visits, and improves their overall health. It's giving them the best tool at their disposal for preventing flu this season. And then convenience, if we're making it as easy as possible for people, including on-site vaccination or just those resources related to immunization clinics near them, we're taking away that additional barrier and just making it convenient for everyone to get vaccinated. Next slide. So ways of encouraging influenza vaccination in the workplace. So this is, again, just building a culture of prevention and a culture of immunization within your practice. I know I've hammered this point home many a time, but offering a flu vaccine clinic on site is really your best bet for bolstering those immunization coverage rates. In the event that you can't do that, that's not always going to be possible, we understand. But we just ask that you be flexible in your HR policies. So establish policies that allow employees to take an hour or two to seek flu vaccinations in the community. Again, just making it convenient. Using promotional posters and flyers to advertise locations in the community that offer seasonal flu vaccine. Display posters about flu vaccination in break rooms and cafeterias and other high traffic areas. Just the more opportunities we have to be hammering this point home, the better. Fourth, post articles and company communications. So if you have newsletters or an intranet, you know, that's just accessed by your internal staff, or emails or employee portals, post those flu promotional materials, some facts in there about to just again, improve upon that flu vaccine communication and where they can access vaccine in their community. You can share the flu vaccine finder tool with employees. That might be a good tool to include in company communications to allow them to find out where they can get a flu vaccine. Maybe doing it close to work isn't, you know, the end all be all method of convenience for employees. So maybe they want to do something that's a little closer to home. So they can go to vaccinefinder.org and type in their zip code or their address and find immunization locations near them. And then lastly, encourage flu vaccination for employees' families by distributing information for employees to take home. You know, it's, of course, we're choosing to focus on a healthcare professional perspective and the importance of this population getting vaccinated, but really we need everyone who can be vaccinated to do so to, you know, increase that herd immunity for the greater good of our community. Next slide. As promised, we wanted to provide you with some state-specific contacts. We have 2 slides worth of this, so don't feel like you're being left out if you don't see your state represented here. But we wanted to provide contacts at both the Immunization Coalition and State Immunization Program levels. Nevada we're lucky that we have one statewide immunization coalition, Immunize Nevada, for whom I represent today. And in that way, we're able to develop a cohesive effort for promoting immunization coverage for our whole state's population. We're also in constant contact with the Nevada State Immunization Program, for whom Renee works as their CDC public health advisor. So that we ensure we're broadly meeting the needs outlined by the state and the feds. But each state and their respective immunization coalitions and immunization programs capacities are going to look a little different. So some states have many coalitions to serve varying degrees of population. Some serve just kids, just adults, immunization across the lifespan. So this is by no means a comprehensive list, but we wanted to provide some context to get started. So immunization coalitions and state programs serve as repositories for state-specific resources and partners that can help you get educational materials and get connected with vaccinators who may be able to help come on site to administer flu vaccines or provide those additional resources. Next slide. So here you see New Mexico, Washington, and then lastly Nevada represented on this slide. Again, you'll be able to access this slide set, so don't feel like that we shortchanged you by hanging out on that first slide too long. So we'll be sure to get you all this information as well. Next slide. Additionally, we wanted to highlight 3 of our favorite national organizations and agencies for finding flu vaccine promotional resources. The first of which is Families Fighting Flu. Their website is listed there. They have healthcare personnel specific resources. So both for promoting flu vaccine uptake in healthcare settings, but also for communicating with patients. An example of one of their patient communication tools is featured, and this is their Communication 101 fact sheet for how to respond to questions about flu vaccination. This resource specifically does a really good job of just breaking down into bite-sized chunks of what those most common flu questions are from patients and healthcare personnel, and just a script for how to best answer that and make that script your own. So an excellent resource that there. In addition to this resource, they have various infographics and flu fact sheets. The wonderful part about Families Fighting Flu is, again, by the title of their organization indicates, they're all parents of children or loved ones who have either died or survived really horrific episodes of flu. They do a fantastic job of personalizing the fight against flu and contextualizing that, I know especially in the public health sphere, we tend to do this, this kind of overall broad fact-based appeal, and that is just not going to work for everyone. Some people respond, in fact, most people respond a lot better to the power of personal stories, and that's what Families Fighting Flu provides, is just discussing that the flu is serious and something that we owe to our community and to ourselves to protect ourselves from. So an excellent resource there. Next slide. The second resource that we wanted to highlight is the Immunization Action Coalition. The IAC is where those immunization or vaccine information statements come from. They are available in various languages. They've also done an excellent job of putting together what I think is a really helpful handout here for communicating the benefits of seasonal influenza vaccine during COVID. So again, dispelling kind of those most common myths around flu in the context of COVID, which is of course really relevant right now. So an excellent resource for those of you looking to kind of meld those two pieces of information together. Next slide. And lastly, we wanted to leave you with the Centers for Disease Control and Prevention, or again, the CDC resources. They are still the foremost agency for all things public health, flu included. So they have tools for healthcare personnel and administrators for how to make a strong flu vaccination, again, using that share method that Renee had discussed earlier in our presentation. They have the hashtag How I Recommend CDC vaccination video series, where clinicians can share their approach to answering patients' questions, concerns about flu vaccination, along with various other vaccines, so pneumococcal and shingles, and vaccines across the lifespan as well. So it's helpful to see a clinician doing it and modeling those best practices as a resource as well. And then lastly, they have their fact sheet, the FAQ, frequently asked influenza questions for that has been updated for this season as well. So all great resources there too. And that next slide will do it for the bulk of our presentation today. Renee and I are happy to answer any questions you have.
Wonderful. Thank you very much, Adrian, for bringing us to that last slide. All right, so while people are thinking about their questions, I'm going to encourage you to go ahead and put the questions into chat, please, if you have them. We did have one right at the outset about recording this webinar. So yes, this webinar is recorded and we'll make it available on our website after the presentation. So thank you very much. And I also wanted to encourage people to visit our entire 2020 Hot Topics series if there are any that you've missed. We had really great presentations this year on adverse drug events, opioids, behavioral health, and reducing self-harm, boosting mental health and compassion fatigue during the health crisis, end-of-life conversations during COVID, and best practices for addressing delirium. So we put the link in chat already so you know where you can find the recording when we're done with this. And so also you'll see that our newly revamped Comagine Health webpage on this last site. So I'm going to go into chat and take a look. Please go ahead, and if you have some questions, we've gotten a lot of great information. Thank you for sharing your expertise and experiences.
I wanted, Shannon, really quickly just to address something that we didn't have a chance to discuss in the bulk of the presentation, but I know that this is a concern. Again, I touched upon it very briefly, but among healthcare personnel who, previously there were maybe organizational policies in place that if they didn't get vaccinated against the flu, that they were to wear a mask, which organizations is still in place, but obviously because everyone's wearing a mask now, there's been a little bit of misinformation out there, or I guess hesitancy, around why it's still important to get vaccinated against the flu if you are wearing a mask anyway. And as I briefly discussed, you got to think of the mask as one tool in your toolbox. So in addition to, social distancing protocols that are in place, and or physical distancing protocols and mask wearing, increased hand washing, all of those pieces. The difference between flu vaccine or flu as a respiratory virus and COVID is that we have an effective vaccine on the market for flu. So, why not add that additional layer of protection and do, so you're able to say that you're doing everything within your power to protect the population you serve, yourself and your family from flu this season. So I think that's just an important thing to note of.
Wonderful. We had Linda actually asked if folks would be able to share any strategies that they've used in their particular setting to increase healthcare worker immunizations. So we'd certainly love to hear that. Have you seen, just to kind of, while we're waiting on any comments, have you seen anybody in your work have a particularly effective way of getting around some of the barriers that you mentioned earlier? Any creative stories that you guys can share from your experiences with immunizations, Brianne or Renee?
I think, again, just that point of making it as easy as possible. We've been doing administering a flu survey at each of our community clinics, of which we're doing a ton right now in preparation for COVID vaccine response as well. Again, just in prep for that in the case that a potentially effective and safe vaccine is released to market. And we are seeing a lot of people come through that had never been immunized against flu before, who, because of COVID, if anything that the media coverage has done, it's really highlighted how many deaths we see from flu every year. and how important it is to get vaccinated and protect yourself. So again, I think that we're in our community clinic model where we're able to get out to community organizations or some faith-based organizations that we maybe hadn't been contacting before. Just the fact that we're in close proximity is huge. I mean, you would think that having pharmacies and mini retail grocers would encourage people to get a flu vaccine, but a lot of times, especially now, they're just looking to get in and out of those spaces. So just making it as seamless as possible. We're doing an appointment system for many of our community clinics as well, so that we're able to communicate ahead of time or space people out ahead of time, and then also communicate kind of the safety protocols that we have in place in relation to COVID, which I think is great for people, especially that are in these high-risk populations that are hesitant about going to their primary care providers in a pharmacy, typical pharmacy setting to access these vaccines. So I know that other states are doing community clinics as well, including many of the states that Comagine serves. So using those coalition contacts and the state immunization program contacts to identify where those locations are at to help connect folks in the absence of being able to do it on site at your respective facilities, I think is really helpful.
Okay, great, thank you. So we had a couple of comments. Let's see, we had Pauline shared that we do have a PMP in place for vaccinations, and it's free to all employees. They've offered all employees to be vaccinated multiple times to cover all shifts and continuously remind directors and other departments that the vaccine is available. We had a comment from Luciana saying in their facility, they've provided both written and verbal education regarding vaccine. They then have a staff member available from morning to evening, offering vaccine and education to staff. For patients, they again provide patient or family education with encouragement, and also involve providers to assist in educating and encouraging, and it's been a very successful year as far as vaccines. And another comment about at Gritman Medical Center receiving influenza vaccine for employment. The clinics offer the vaccine and they post to the public. And then we have a couple of questions. We had one question on, do you recommend requiring staff members who do not get the flu vaccine to wear masks when in patient or resident areas? They weren't sure if they missed this earlier.
You did not miss that. We would, of course, advise that. We were more so touching upon, reasons or methods for encouraging vaccination, as opposed to kind of those protocols to have in place to prevent the spread of flu in the absence of vaccination. But I think that that's pretty typical across, most states right now, as that's a requirement. Anyway, but again, just emphasizing that in addition to wearing that mask, that getting the flu vaccine, regular hand washing, physical distancing when possible is all within your toolkit for preventing the spread, for sure.
Okay. Thank you. And we had one more question, which was, any thoughts on requiring resident visitors to be vaccinated in order to visit, say, a long-term care facility or other facility?
I'm a big fan of vaccine requirements across the board. I think that that might be a little tough of a requirement to enforce and then also to check. But yeah, I think that the way that we could encourage this is to just provide those educational materials, make sure that we are in regular contact with residents, families about the importance of the flu vaccine, and really hammering that point home so that hopefully they will do that in absence of a requirement. Renee, do you have any thoughts on that?
Yeah, I agree. I do think that would be hard to enforce. I don't know if you would be able to. I mean, I guess you could say that they can't enter the facility if they aren't vaccinated, but that's obviously at your discretion. But I definitely think it's a good idea if those people are coming in, because like we were saying, you know, they can pass it to anyone and endanger, especially, you know, high risk and vulnerable people. And so I don't think that is a bad idea at all.
Okay, great. I am not seeing any additional chat questions, so I'm going to give everybody about another minute if there's kind of some final thoughts that you'd like. Oh, here we go. Got a couple more coming in. Okay, so Richard shared they theme their flu clinics each year. This year they chose superheroes and handed free t-shirts to each employee that received the vaccine. In fact, in just 1 week, we were already at a 78% vaccination rate.
That's amazing. I think incentives like that and kind of a sense of community around, again, that's an excellent example of building a culture of prevention and immunization into your workplace. I love that.
Great. Yeah, thank you for sharing. That's a wonderful idea. And we had a question. So let's see, where do we think those below 40 after high school?
This may be an issue or question of like access, where they can access vaccines in that particular county.
Right. In that, is it DuPage or DuPage? I'm not sure. And then how do you know who has vaccines locally?
That would be, so far as accessing immunization clinic opportunities, you know, sometimes a Google search can go a long way. Again, those immunization coalitions that are specific to your state or those state immunization programs are going to be great connectors for those community clinics and advising where folks who are within that age bracket in that county can go. And then I saw another question that had come through too.
Yeah, I'm not quite sure about this one about aware of the customs outcome or customs arrival.
Yeah, let me go ahead. I was scrolling up a little bit too to see the question about, you know, how do you engage in just like an in-person space in talking about vaccines? The best advice that I could lend there is to just approach everyone with empathy and know that everyone's trying to do what they think is in the best interest of themselves and their family. You know, nobody's trying to make deliberately wrong or irresponsible decisions. So I think that in discussing that approach and really getting to the part of what someone's concern is, and even if you don't have all the answers, providing them with a reputable resource is going to be really helpful in that space. You know, the short answer is also we don't know who's vaccinated and who's not. The onus is really on us as individuals to do our part and stay up to date with our vaccines so that we can protect those again who are unable to be immunized.
We had another comment about raffle prizes. Also helps to encourage staff to get the vaccine.
Love it.
Thank you very much for that suggestion. So, okay. And there's kind of a lengthy question that's been coming in. I'm not quite sure how to direct that. So I'm going to ask if Brianna, if you or Renee can kind of take a look at chat and see if there's a response that you want to share for that. And while we're kind of getting to the top of the hour, I just, again, wanted to mention to folks, this is our last Hot Topics for the 2020 calendar year. We'll give you the holiday season off. And thank you so much for joining us, those of you who've been able to come to these events over the last couple of months with us. So stay tuned for updates on future events hosted by Comagine. Once again, I'd like to take a moment to thank our presenters, Brianne Van Dyne and Renee Brocker. And I'd like to thank all of you for joining us and for all of your efforts to keep residents safe and well cared for during this challenging time. We are here to support you, so please don't hesitate to reach out. We'll have this recording together And I see a couple of other folks putting in some recommendations. So thank you so much. There's going to be a little evaluation that pops up at the end of your presentation when you clock out. So please go ahead and let us know how we did and any areas for improvement. We'd love to hear your feedback. So I'd like to say again, thank you to our presenters, Brianne and Renee, for some excellent information, very useful and timely. And thank you to all of you for joining us for Hot Topics, and have a great rest of your day and wonderful weekend. Thank you very much. This concludes our Hot Topics session for today.